With this, we come to the end of our talk. Just to hone in on the key points, again, talk to your doctor about what kind of disease paradigm you're at. Are you is your disease something that is sensitive to testosterone, or is it resistant to testosterone, or what we call as not testosterone, I should say hormone. And the way we label it as castration sensitive or castration resistant. As we discussed, different novel options are available. As physicians, we always try to keep a key balance between the side effects and your quality of life, which is critical for decision making. So please talk to your providers if there are certain quality of life measures that are supremely important to you, because these can help guide us make treatment decisions a lot better. Again, these medications are expensive, and these medications take a toll on your mental health as well. So be open and frank about what the financial stress you might have, and how we have options that we can present to our patients, whether it's in a form of a grant, or assistance through financial aid at the hospital itself. These are all key components that go into the decision making. So it's important for our patients to please bring it up and be an advocate for yourself as well. And last but not the least, your medical team is always there to help you. Their medical providers, whether the nurses, the clinical coordinators, the navigators, the physicians, your care providers, your family. There are so many great organizations who are doing such great work when it comes to prostate cancer. So seek all the support you can from all these organizations as well. Again, we would like to stress this is not a medical advice. This is purely for education purposes. If you have any questions pertaining to your own disease, you should reach out to your oncologist who has been taking care of you. Definitely, you can take advice in terms of educating yourself from this talk, but this in not in any shape or form constitutes as medical advice. Just some, concluding points from Dr. Tawagi and Dr. Kurian. If I missed anything.
I just wanted to
Yeah,
add, make
go
sure you
ahead.
ask about clinical trials depending on where you are, because we're always trying to improve, what the standard is in terms of how well patients do, how many side effects they have. So clinical trials is the only way that we can advance the care of men with prostate cancer.
Yeah, that's very important.
Definitely. Yeah, clinical trials I think are, very important to find new treatment options for all of our patients here. And one thing that I think that we did not touch, and I think that I wanted to mention as well, is that bone modifying agents are another important part of our supportive treatment for prostate cancer patients. So that's something to definitely discuss, with your oncologist, of whether you're a candidate for a medication that is given as an IV infusion every few months that could help decrease the chances of having a fracture in the bone if your prostate cancer is involved in your bones as well. So that's something definitely to talk to your provider about as well.
Yeah, no, I think that's super important. And especially, as we have discussed, prostate cancer loves to go to the bones, and, to make sure your bone health is intact with the agents that Dr. Kurian mentioned, taking vitamin D and calcium, these all are preventative measures that we should do. And we had discussed in the last talk that making sure you have a strong primary care support network, to make sure that you are healthy from a heart perspective, your cholesterol levels, your mood and mental health. I think these are all important issues while we go through the prostate cancer journey.